A 35-year-old woman with a history of asthma and chronic sinus issues presents to the clinic complaining of severe nasal congestion and occasional flare-ups of her asthma symptoms. She mentions that her nasal congestion worsens significantly and she experiences shortness of breath within an hour of taking aspirin for her occasional headaches. On examination, she exhibits signs of nasal polyposis and wheezing when auscultating her lungs. Her medical history also reveals multiple episodes of sinusitis treated with antibiotics and steroids over the past year. She is currently using a daily inhaled corticosteroid for her asthma. What is the likely diagnosis for this patient based on the described symptoms and her reactiveness to NSAIDs? A. Common asthma. B. Aspirin-Exacerbated Respiratory Disease, AERD. C. Chronic Obstructive Pulmonary Disease, COPD. D. Allergic rhinitis. The correct answer is B. Aspirin-Exacerbated Respiratory Disease, AERD. This patient's triad of asthma, chronic rhinosinusitis with nasal polyposis, and a specific intolerance to aspirin or other NSAIDs is characteristic of AERD. This condition involves an imbalance in arachidonic acid metabolism, leading to increased inflammation in both the upper and lower respiratory tracts. NSAIDs that inhibit cyclooxygenase 1 can acutely exacerbate these symptoms by further disturbing the balance between pro-inflammatory and anti-inflammatory mediators and activating mast cells. This case highlights the importance of recognizing AERD in patients with asthma and chronic sinus issues who exhibit sensitivity to NSAIDs. Management strategies include avoidance of QX1 inhibitory NSAIDs, use of leukotriene modifying agents, and possibly aspirin desensitization.